The Shah's overthrow and death would have been but a footnote and passing news for most Americans had it not been for the hostage crisis. U.S. Embassy personnel in Tehran were held captive for 444 days by Islamic militants, and the U.S. could do nothing except stand by and watch as American citizens were blindfolded and paraded for the world to watch. The Shah entering the U.S. was the cause of the embassy takeover in Tehran, but President Carter's decision to allow him in for medical treatment was never fully examined by history, even though it cost Carter his presidency. The official reason given was humanitarian. We cannot allow him to die in Mexico. They have an inferior medical system, and the Shah deserves the best. He was our friend, and we cannot abandon him to the Mexican doctors. On the surface, that all made reasonable sense, until we traveled to Mexico City and spoke with Dr. Jorge Cervantes. Dr. Cervantes is not just a Mexican doctor, but he's one of the most accomplished surgeons in the world. Besides being the head of the American British Hospital in Mexico City, Dr. Cervantes was the chief surgical resident at Georgetown University. He's a diplomat with the American Board of Surgery and the U.S. State Department medical doctor in Mexico. He was definitely the most qualified doctor to remove the Shah's gallstones.
My name is Jorge Cervantes. I'm the professor of surgery at the American British Cavalry Hospital in Mexico City. I did my medical training in Mexico, and I took my surgical training at Georgetown University in Washington, D.C. And I have been here practicing surgery for the last 43 years.
Doctor, what was or is your position with respect to the U.S. government at the time of the Shah entered Mexico and currently?
Since about 1970, I have been the medical advisor to the U.S. Embassy. In that position, I have had a chance to treat many patients from the U.S. government. I have done operations on 4 U.S. ambassadors to Mexico, and every time a big shot or somebody related with the U.S. Embassy comes to Mexico or needs medical attention, I'm usually called to see him.
When did you first get involved with the Shah's medical care in Mexico?
Well, I think it was in the middle of October when somebody from the U.S. Embassy called me. There was an important fellow in Cuernavaca who was responsibility of the U.S. was taking care of all his problems, and they were not giving me the name. They were just an important who had a problem with jaundice, that means icteric, and abdominal pain. That was all I was told.
And can you tell us about when you saw the Shah, when you first
Well,
saw
it was top secret. Nobody knew who he was. So went to Cuernavaca with somebody from the medical unit, and I was escorted to a big home, beautiful homes. There are beautiful homes in Cuernavaca. And in a room there was this man. He would look elderly. I didn't know him. And he was extremely jaundiced, like this yellow pad you have. And I asked about his abdominal pain. He had pain in the right side. And I asked about his stools, and I was told by somebody that there were 2 or 3 people there that he was dark. He had dark urine and light stools. I said, that's obstructive jaundice.
Were you aware of his medical condition?
Nothing.
Beyond this at all?
Nothing. I was told, what is your impression on that? And my impression was gallstones blocking the bile ducts, and he needed an operation.
Dr. Cervantes, who was making the decisions for the Shah when you met him, when he was your patient and you saw him? Who was making the decisions for him?
The public relations people from Rockefeller. I think Bob Armao.
the common stories tell us that doctors in Mexico diagnosed the Shah with malaria. Uh, please tell us about that. Who, if anybody, diagnosed that? Where did that come from?
Maybe from the American team, because malaria, we are a malaria-free country since the early 60s. So there's no malaria in Mexico. In Cuernavaca, there's no malaria. It's an unknown disease. Maybe, I remember when I was a medical student, there was a big campaign to eradicate malaria in Mexico. And in the early 60s, they said no more malaria. So I don't know who made the decision, malaria, but that was not made by Mexican doctors, no.
Okay. Yeah. From reading Dr. Keen's account, I guess that was the impetus, that was the rationale for inviting him. He's an infectious disease specialist to Mexico. Please tell us what you thought of his involvement when he came in, what your take was on Dr. Keen.
Well, I was surprised to see an expert in tropical medicine coming down, sent over by Rockefeller, to treat a patient with a surgical problem. I have no idea why a tropical medicine expert had anything to do with somebody with gallstones and blocked a biliary tree. But that's the way the politicians were handling the problem.
Did you communicate that concern with anybody at that time?
No, with the people at the medical unit at the U.S. Embassy, I told them there's no malaria, he needs an operation, and the operation has to be done soon. Otherwise, there's going to be more trouble with the liver damage.
According to Dr. Keen, he came to Mexico, he examined the Shah. The Shah didn't share his medical history with him, and he went back. After that, Dr. Flandrin, his French doctor, came to Mexico. Could you please tell us your impression of him and your experience with him?
Well, I never met him, and I was surprised that the French hematologist was treating the Shah for a hematologic problem, malignant problem, without a proper diagnosis and in secret, and nobody. I don't even think the queen or the wife of the Shah knew the problem. So the whole thing of treating somebody with a presumed diagnosis, giving him chemotherapy without a tissue diagnosis, that's a mistake. Because the Shah was a very important person. So, but you don't practice medicine or surgery because somebody is very important. You practice medicine or surgery because you are asked to see a patient and you offer, to the best of your knowledge, what the best treatment is. And treating somebody at a distance for a strong medicine like chemotherapy without a tissue diagnosis is not proper medicine.
According to Dr. Flandrin, at a later date, he shared the Shah's medical history, it's a 30-some-odd page report, with Dr. Keen and the Shah's Mexican doctors. Did you or any other part of your team ever see that report?
No.
So at no time was the Shah's cancer discussed with you?
No.
How did you know he had cancer? When did you discover?
When the whole thing broke out after the operation in New York, they took a lymph node and they found the diagnosis, and the whole thing became more widely known.
But when he was in Mexico, you had no idea that he had cancer?
Nobody knew anything.
Which other Mexican doctors had involvement with treating the Shah?
I know that an expert in radiotherapy from the Social Security Hospital, Dr. Noriega Limon, was consulted. He never saw the patient. He was consulted about possible radiotherapy for a possible. I think the French doctor, Flandrin, apparently got in touch with the Mexican expert on radiotherapy, who was the head of radiotherapy at the Social Security Hospital.
So they never had a Mexican oncologist?
No.
When did you first hear about Dr. Keen not wanting to treat the Shah in Mexico?
I was in Washington, D.C., and having dinner with. I visited the State Department, then having dinner with the doctor from the State Department.
Doctor, can you please mention his name?
Dr. Even Dustin.
Dustin.
And we're talking about the facilities for operating in Mexico, and I said we had everything ready at the ABC hospital, and everything was, well, according to him, we were ready to bring him over. And then all of a sudden he was called over the phone and, you have a CT scan in Mexico? I said, no, we don't have, but we don't need it. We can make a diagnosis with regular ultrasound, which we did at the time for everybody with gallstones. Mm-hmm. We always use ultrasound. Nobody even thought about the CT scan for regular biliary duct obstruction. No, we didn't have one. And then he went back to the phone, and that was it.
We were told that when President Carter called Dr. Dustin to get his opinion on the Keene diagnosis, saying that there wasn't adequate care here in Mexico, Dr. Dustin asked your opinion, and you gave him that opinion.
I gave the opinion that we had we had the best private hospital in Mexico. We had the facilities to do the diagnosis. We had the facilities to perform surgery, and we had everything. And apparently, Dr. Keene thought the Mexican facilities were inadequate.
Did Dr. Dustin confer with your recommendation that you had adequate facilities here to take care of it? Did he agree with you?
Well,
I mean, what was his recommendation to Carter?
I don't know. I think he told him that we didn't have the CT scan. But at that time, when this happened, I had already done 2 operations. I had operated on 2 ambassadors to the U.S. Mm-hmm. So they knew that I was a board-certified surgeon, and I had been trusted to operate on the U.S. ambassador to Mexico. What more proof of confidence you needed?
Why do you think that Carter admitted the Shah, knowing that the Islamists would storm the embassy, when you had actually given them the facts that you guys can do the surgery here? What do you think was it that convinced Carter?
President Carter was misled by his people at the State Department. Under pressure, I think, with the Rockefeller friends and Kissinger, they told him Mexican facilities are not good. And so, President Carter was very reluctant to admit the Shah because he knew all the possibilities. He was alerted by his own people that there was going to be big trouble if he admitted the Shah. But then he was forced to. They told, you cannot abandon a friend. We put him in power. He is sick. In Mexico, they don't know how to do things. For humanitarian reasons, he said, let's admit him.
How did President Portillo take this whole thing? What was his view of the Shah, allowing the Shah to come in, and then it's kind of like a slap in the face, saying you're not good enough to do this. But
before that, the Shah was very reluctant to go to the U.S. He said they don't want me. Yes. He was happy here. You talked to his wife. The best part of his exile in Mexico was in Mexico. He enjoyed life in Mexico. He was free to move. He went over the place. He went to places. He went to Acapulco, to pyramids. He established friendship with Mexican friends here in Mexico. He played tennis with some friends whom I know him, and I know the friends that they play. He was very happy. He didn't want to go to the U.S. because he felt he was not welcome there. So for me, if somebody doesn't trust me and he goes away, I don't feel bad. I mean, that happens. Anybody can choose his own doctor, and I don't feel bad about that. In Mexico, I mean, the Shah was taken away, but when the U.S. had a big hot potato at hand, and they they wanted to send back the Shah to Mexico, the Mexican Foreign Ministry, Mr. Margain, who was a very close friend of mine, called President Lopez Portillo and told him this is an affront. They sent the Shah to the U.S. allegedly because Mexico didn't have the facilities. Now they have the big problem. Now they want, like he said, we don't feel happy with that. That's an affront to the Mexican government, the Mexican system. So they told him, you are not welcome anymore. Your visa has expired.
So that was the reason he was not readmitted.
Yeah.
Because we've heard in different sources saying that the reason President Portillo didn't allow him back in, because Mexico was trying to get in the UN Security Council and they needed Cuba's vote.
No.
It had nothing.
It had to do with the medical affront. I mean, the Mexican people told President Lopez Portillo, if we are not good to treat him, we are not good to rescue him.
The Shah left Mexico believing that he had an open invitation to come back.
Yes. They kept him home here.
Yeah. So when he left the U.S., he always thought he had a way back here.
Oh, I think so.
When did that change, that invitation? When was that revoked? After he left?
No, the invitation was revoked after the Iranian students, or so-called students, took the embassy, and the big scandal broke out, and the Iranian government said that if the U.S. didn't give the Shah back to them, they were going to kill one of the hostages every 24 hours. The big noise all over the world. And I think that's when they made the decision, okay, send him back to Mexico.
And was your government concerned about the Iranian government and their reaction?
No, Mexican government wasn't happy about the way we were treated. No, you are not good. You don't have the facilities to treat him. Now they have a big problem. Now you do have the facilities. That's a bad thing.
So the Shah was taken to New York, supposedly to get adequate care. Please tell us your opinion of the surgery performed by Dr. Theodor Bjornson to take out the stones. Can you, as an expert surgeon, can you tell us?
Sure, of course. I know that Dr. King wanted the Shah to have the most famous surgeon for gallbladder problem in the U.S. at that time, Dr. Frank Glenn, to do the operation. And of course, he didn't do it. They sent somebody else, Dr.
Theo Bjornson.
And in 1979, when a surgeon sees a patient with gallstones and bile duct stones, he has to do the right operation, and he didn't do the right operation. The right operation is remove the gallbladder and open the bile duct and do a cholangiogram, that means x-rays in the operating room, and fish out the stones of the bile ducts, irrigate, and put a T-tube, it's a T-tube to decompress the bile duct. And before closing, do a operative cholangiogram to make sure you do not leave any stones in the duct. That was not done. As the Queen said, he got the worst possible treatment. I mean, anybody, not the most important or the most humble patient. The patient has to get the best treatment. And the best treatment for somebody who has gallstones and stones blocking the duct is to remove the gallbladder and remove all the stones and leave a free flow of bile from the liver into the duodenum. And the Shah didn't have that. What happened? After the operation, the Shah went to the operating room because he had obstruction, bile duct obstruction. He was jaundiced. After the operation, he continued jaundice. So the problem was there. The gallbladder was removed, but the stones that were blocking the duct were there. And then in the postoperative period, through the T-tube, they injected some dye, and they did know that there were 2 or 3 stones. I wanted 2 stones left.
In your opinion, if the Shah, I mean, you can't say for 100% sure, but if the Shah would have had that surgery done here, would he have had the same complications with the stones left?
I have been in practice in Mexico for 43 years, and I have had many patients with biliary duct stones, and then I never left one.
I pressed Dr. Theo Bjornson. I even brought it up that some people say that you made a mistake with him.
Yeah.
And his response to me was, I did the physical examination, I couldn't find the stone. I used the x-ray that we had in the surgery room, but at that time that x-ray was not very detailed. And a couple of other doctors that I spoke with, they said, that's a common thing. But in your opinion, that shouldn't have happened.
No, I mean, New York Hospital, one of the best medical centers in the U.S., don't kidding me. And the equipment to do the operative cholangiogram is not good. That's nonsense. He made a mistake, and you have to admit. From every point of view, as a surgeon, doing a gallbladder and leaving stones is not a good operation. It's malpractice. They could sue him for malpractice.
Now the second aspect, the controversial aspect of that surgery. Dr. Morton Coleman, the Shah's oncologist, said that they were aware of the enlarged spleen, and he had considered one of the primary actions to take after the stones is to take out the spleen, do a splenectomy. He mentioned to us that he walked into the surgery room while Dr. Theo Bjornsson was doing the surgery and said, Toby, take out the spleen. And Dr. Theo Bjornsson turned around to him and said, you're a much braver man than I am. And he left the spleen in there. When I asked him about that, he said, this is selective, this is elective surgery. And we were there to save his life in the jaundice situation, and we didn't consider this important enough. What is your take on that?
Well, first of all, nobody knew that the Shah had a malignant problem at that time. They knew that he had a benign problem with gallstones and Bocage biliary duct. So that thing has been going on for about 2 or 3 weeks. When that happens, you have to go in and treat that problem. Forget about other things. I think Torben Jarsson was right in not doing the splenectomy in time. The Shah having a biliary duct obstruction, stopping all the bile going from the liver into the intestine is a big problem. So you have to fix that and let the liver recover and then do whatever you have to do. But I understand he did a lymph node biopsy, no?
Yes.
And that was the first time that they had a tissue diagnosis.
Correct.
No. Having a splenectomy at that time, that will not be good surgery.
So you concur that?
Yeah, I concur with that.
It would have been too much risk to the patient at that time. But then again, when it came time to do the splenectomy, when he was in New York, they didn't do it, and then he went to Texas, the Air Force Base. They didn't perform it there either.
No, because the U.S., the main concern was to get the Shah out of the U.S. Then they want the Iranians to keep the wars of killing every American, one American every 24 hours if the Shah was not returned to Iran. They wanted the Shah out of the U.S., so they sent the Shah to Panama.
I know you're personal friends with many of the doctors in Panama who were in charge at that time, Charlie Garcia, Dr. Garcia de Paredes. First of all, before we get into what happened, what do you think of the medical establishment in Panama, their capabilities and their qualifications for having treated the Shah?
Panama had good surgeons. Dr. Garcia, Carlos Garcia, the surgeon, trained at Georgetown University where I did my training. I knew him from there. And he was the personal physician of the Panamanian strongman, Dr. Torrijos. In Panama, they had good surgeons, they had good hospitals, they had all the facilities available.
Here's where we get into Dr. DeBakey getting involved in this case. Mm-hmm. And it caused a lot of turmoil in Panama. What do you think of his involvement, his qualifications in this?
It was bad. It was his ego. I mean, he's a big man. He's a famous cardiovascular surgeon. He's known all over the world. He's 70-something and he's almost close to retirement. He has a big name. Why you being in that position, you accept to go to a different country, which is not a good idea, to do an operation that you haven't done maybe in 30 years or 40. He was a big man in abdominal surgery in the 40s, And then in the 60s, he became one of the top surgeons in cardiovascular surgery. And then all of a sudden, because he's called to see a very famous patient, he forgets about all his thoughts about, you are not supposed to go to a different country to operate and come back. By the American College of Surgeons, that is not considered a good practice. They call itinerary surgeons who go to a place and operate and go, and that is bad practice. I don't get it. Why? Well, you are called to see a famous surgeon, to see a famous man. You are not an expert on that. Don't go. That's my impression.
Had Dr. DeBakey come to Mexico and you were in the same situation as the Panamanian doctors were,
of course,
what would your reaction have been?
I will ask the same thing Dr. Carlos Garcia asked DeBakey. Dr. DeBakey, may I see your Mexican credentials?
But in the end, the Panamanian doctors even cooperated with him, saying he could participate in the surgery.
As an observer.
Would you have allowed that?
As an observer?
As an observer.
Many times I have patients, doctors come. We, at the ABC hospital in Mexico City, we frequently have international visitors who come to see our program. And they come and see our surgeons and our people doing things, and we're open. The same in the US. Many times we go see a good friend of ours in the US, and you go into the operating room and as an observer. That's a common thing to do.
But you wouldn't let him participate in the surgery?
No,
as active,
not even, no. As the Panamanians wouldn't do that. No surgeon with self-respect will allow himself to let somebody from another country come and do the operation for him. If you're in charge, there's only can be one chief, one captain of the ship.
As a very qualified surgeon with a lot of experience, having written many books, what is your opinion of Dr. DeBakey's splenectomy that he performed on the Shah?
That's bad practice. The first thing when you do a splenectomy is to take care not to injure the pancreas. The spleen is like it has this little form, and the tail of the pancreas goes like that. So any surgical teaching tells you that when you go in there to remove a spleen, you have to take extreme care to avoid damaging the pancreas.
And the pancreas was damaged?
The pancreas was damaged. The Egyptian surgeon who was a second assistant in the operation in Egypt told Dr. DeBakey, that's the tail of the pancreas, and apparently he was pushed down. And the pathologist in Egypt, who they saw the specimen, you can read. They say we received the spleen that weighs that much and much, and there is a tail of the pancreas with the specimen. That is a bad surgical practice.
And the same was said when the spleen was sent to Walter Reed Medical Center, and they came with the same conclusion.
I don't know about that, but I know that from the Egyptian surgeon who was present, and that he saw that the spleen was the pancreas was damaged, and the pathologist who received the spleen, they found a piece of the pancreas. That's bad surgery. Done by a very famous man. Dr. King told the Shah in Panama that he didn't want to have the operation in Panama because he didn't trust the Panamanian surgeons. He wanted the most famous surgeon in the world to come to Panama to do the operation. And with all those fanfare and noise, Dr. DeBakey comes to Panama. I come here to operate on the Shah. How do you feel if you were a Panamanian surgeon? No?
And they didn't feel very well.
No,
Speaking to them, they have the same feelings that you have about this. One other thing that I read in an article, in an interview with Dr. DeBakey after that, they asked him if he had nicked the pancreas. He said no. And they said, well, what could be some of the reasons for the damage to the pancreas? And he mentioned the clamps used in the surgery. Would that have caused the damage?
No, the damage was caused by poorly done splenectomy.
You think that's just no practice or lack of practice?
You have a very famous surgeon doing heart surgery for 40 years and then going into the abdomen, that he has done that, I guess, for many years, and having an enlarged spleen. You have to be very careful about how to approach that. Apparently, he was not.
Dr. Cervantes, what is your personal opinion of the Shah, having seen him, having had him as a patient? What is your take on him as a man?
My opinion is, how come to let yourself go into the things that having agreed to have secret treatment without diagnosis, that's not good. Having kept his medical problems away from his family is not good. Not even his wife knew what the problem was. And then putting himself in the hands of a public relations man to handling all his decisions. You have to make your own decisions. You have to call your shots. I mean, you have to be in charge.
Do you feel he was at all?
He was not. He was a puppet, going, okay, you go film, you don't go.
When you spoke with him, when you saw him, what was his personal mood? What was
He was a sick man.
You feel he had kind of resigned to whatever happens to him?
I mean, when you are sick, you're sick. I mean, jaundice, you have pain, you're suffering.
Doctor, we know you've done research and operated on a lot of famous people. You're writing a book, you've done research into famous patients and their complications. What lessons can we learn from this whole fiasco to better treat high-profile patients in the future? What can we learn from this? What do we take away from this?
You have to see every patient like a human being, not as famous or very rich or very important. Or you treat every patient as a human being and give him the proper treatment, no matter if he's a poor man or a middleman or a very rich or very famous. When you get involved into that, you make mistakes.
What is your opinion on the public, people knowing the truth about the health situation of their leaders? Do you think people have a right to know? Do you think in the future doctors have a right to disclose these things, especially when they're treating high-profile patients? Or do you think it's justifiable to keep it secret like the French and the Iranians did for years, and then it has consequences?
Well, I think the people has to know about the medical problems of the people who are in charge of their destiny. The presidents or prime minister, whenever they get sick, the people have right to know who is handling their lives. As far as the doctors, we have to keep a secret from one of the Hippocratic oaths is to patient's secret. I mean, to us, everything the patient tells you is only him and me. We never disclose any information from a patient. Now that when the patients died and there's a big problem, then we cannot do any harm in discussing our views about the medical problems. But there are many examples. I'm working in a book on very famous people having really bad mistakes because they are so famous. The title of the book is going to be Famous Patients, Bad Mistakes. I'm working on that.
Should be a fascinating subject. We agree with what you said. This is kind of our understanding too, where the physicians have a duty either to not say anything, keep the secrets of their patient, or they tell the truth. Now, in this scenario, we went back, we spoke with Dr. Safavian, and he came out and, he's a professor of medical ethics in France, and, he's an old-time doctor from a different generation. And I kind of put it to him, and I asked him, who decided to keep the Shah's cancer from him? And he said, I did, as his doctor. And he defended that with the older philosophy of a physician as the one who knows best for you. He said, when you come to me as a physician, you're putting your trust in me that I make the best decision for you. Do you agree with that?
No, no. I mean, when a patient comes to you, he's putting literally his life in your hands, and you see a problem, you have to tell him. I mean, keeping the secret, what the patient has, that is a big thing. I think the doctor has to be frank and inform the patient what the situation is. Not telling the patient the truth is bad practice. I tell my students all the time, I mean, treat your patients the way you like to be treated yourself. You know, I'm the professor of surgery. I have a lot of alumni, and my job is to tell them how to conduct themselves when they see a patient. Of course, you don't go out telling everybody what the patient has, but you have to tell the patient.
And there was a second aspect of that where when they didn't want the Shah to know he had cancer, so they brought out the Waldenstrom's diagnosis. And that gets into another area where, as you said, the doctor has a duty either to tell the truth if the patient allows it, or keep it secret. But what about the doctors coming out and creating another diagnosis to kind of divert the attention? What is your opinion on that?
Bad practice. Bad practice. You have to act always with the truth, and be honest, and tell the truth, and don't let yourself, a doctor, being involved in political decisions. I mean, because somebody is important, you don't have to tell him what it is now. Because somebody is important, we have to call the most famous man in the world to do the operation that he hasn't done in many years. That's not correct. I mean, if you have to conduct yourself properly and with ethics, and to be right all the time, and to be respectful of human life. If suppose I'm a famous surgeon, and I'm called to see a patient with a different disease, well, I said, that's out of my area. Call somebody, no?
Yeah.
No, not. Yeah. If they call the Becky, okay, put yourself in the name and the shoes of the Becky. Dr. DeBakey, you are the most famous surgeon in the world. There's a famous surgeon in Panama, a famous patient in Panama. What would be your advice? Well, the most famous surgeon in Panama to do it. No, go to a different country to offend the local people. I'm coming here to operate on the Shah.
This would be conjecture, but what do you think his rationale was for accepting this?
I mean, it's famous. I mean, I'm so famous, like Dr. King said. He told the Shah in person, I want the most famous surgeon in the world to come and remove your spleen. So it happened, the most famous surgeon in the world hadn't done a splenectomy in 40 years.
Following up on what you just said, the Shah requested the most famous doctors, the best hospitals, and most of the doctors that we spoke with.
He didn't request that. He was told he was going to be this, do this, and he was a puppet. He had no saying in his own medical problems.
Most of the doctors, Dr. Cervantes, they told me that if the Shah was an average citizen and walked into any hospital in any major city, he would have not had these complications, and he might have had a longer life. You agree with that?
Yeah, I'm 100%.
Did the Shah ever step into a medical office or a hospital or clinic here, or you just...
in Mexico, no.
You just went to his house in
no.
Cuernavaca. And you personally examined him?
Yeah, and in Iran, in Tehran, I don't think he went to an office. The doctors went to his palace to see him.
Yes, correct.
Niarvaran Palace, what's the name?
Niavaran.
Niarvaran Palace.
Niavaran, yes. So there was no Mexican diagnosis of malaria here?
No. When David Rockefeller came and he saw that she was sick, he was jaundice, and somebody mentioned malaria, he went back to New York and he sent his tropical medicine expert and the whole thing. Then the tropical medicine expert was the expert in surgery, in cancer, in everything.
Well, we talked to his team, and his team complained that they were not informed of what was going on with him. Everything was compartmentalized. Mm-hmm. I'm not sure if that was a good choice for him.
Talk to the French surgeon, Dr. Flandrin. said he was appalled. How come, when he withdrew from the case in Cuernavaca, he said, here I have an elderly guy who is sick with problems here, has a malignant problem, and so then all of a sudden comes a expert in tropical medicine to call all the shots. He said, forget about that.
What was your experience, your interaction with the Queen? You spoke with her?
No.
She didn't come to the hospital either?
No.
Do you have any thoughts that you want to share with us in conclusion of this? Your opinion, that's something you want to share with us on this?
My conclusion is how sad is to have a patient medical problem getting handled in the worst possible situation by political reasons, and keeping secret the problems. Going in silence to do malpractice. The whole thing is a book of malpractice from the point of view of hematology, oncology, surgery, handling the complications. When the Shah developed sophrenic abscess after the splenectomy, that was due to splenic injury that was not recognized, and had 2 months elapsed since the surgery until they had to call a French surgeons to go and correct the problem. It's sad to see somebody going through all that things without him having anything to say.
Had the Shah received the proper care, what do you think his outcome would have been?
Much different, yeah. Even in his own country, he didn't trust his own people, no?
Yeah. After our interview, Dr. Cervantes invited us to Cuernavaca for a tour of the Shah's residence. This street is where the Shah stayed at while he was in Cuernavaca, Mexico. Down the end of this cul-de-sac was the house where he stayed. This house here and this house here was where the Shah of Iran stayed. We were introduced to neighbors of the Pahlavis who played daily tennis with the Queen and her entourage. Dr. Cervantes wanted us to know that the Shah was well treated in his country. As we know, the Shah was not making the decisions. But had he stayed in Mexico, the gallstones would have been removed successfully, the splenectomy would have been performed in a timely manner and under better care, and perhaps the Shah's cancer could have been treated. We will never really know, but the decision to leave Mexico was one with profound consequences for the Shah, Iran, the US, and the rest of the world.